PPCM is all global, affecting women from everywhere.
Yeah, so hey everyone, again, I'm Sierra. So in 2022, I had my second child, my son, Hill. It was a normal pregnancy. Like, I didn't have any issues. I mean, I was kind of stressed because my husband was in a motorcycle accident, so he lost his spleen. And I thought that kind of contributed to like maybe my diagnosis, but they said, it just comes. But thank God my husband, he's recovered and, we're blessed about that. So I started having chest pains 4 months after my son was born. So it started in September of 2022. And I didn't think nothing of it. I was like, okay, it hurts, boom. And then the shortness of breath comes. And I'm like, okay, maybe I'm just out of shape. I'm breastfeeding and pumping because I pumped a lot because I had an excessive supply. So I was able to donate to the milk bank as well. So I thought it was just, just tired mom. And we had stairs in our house. And then what really started like having me worried is like when I would lay down or when I would sleep, it felt like I was drowning. Like I couldn't breathe and it felt like crushing, like something was just crushing my chest. So I told my husband, it was the week of his birthday. I was like, I'm like hurting. And he was like, you're doing too much, you need to take it easy. Because again, I never experienced this. I have a 10-year-old daughter and my pregnancy with her and afterwards it was like great. I bounced back really fast. Um, so anyways, like the day after his birthday, like I could barely get up and walk without like just having like, shortness of breath. Like I couldn't breathe. And it got really bad where I couldn't get up and walk. So I went to the hospital and they admitted me that night. I stayed there for 5 days. They ran a few tests, like an EKG, some blood work. And the first time I was there, they said, it's probably just you're tired, you're stressed, or maybe high blood pressure. So they gave me some medication for high blood pressure and, told me take it easy. Okay, so a month later in October, the symptoms they started coming back. So this time it was worse than it was before. Like I could just be standing up and having trouble breathing. The chest pains got worse. I started having headaches. So I was like, okay, let me go to a different hospital. So I went to a different hospital and they ran a lot more tests. Like they did a right heart catheter. They could have swam in my neck, like a lot of things that the other hospital didn't do. And so this was my official diagnosis. I was there in that hospital for a week, and they're like, "Oh, we're gonna go ahead and remove your gallbladder because this could be causing some pressure on your heart as well." So they removed my gallbladder, and I went home. They, gave me I think like 3 or 4 different medications to help with like some of the fluid around my heart. And they're like, just follow up with our cardiologist in 6 weeks, and we'll go from there. So from October to the end of December, I was okay. I was taking the medication. They told me about they labeled it postpartum cardiomyopathy. And then they were like, once you meet with the cardiologist, they'll go into it. They really didn't give me any explanation on how I got this or what exactly it was. They were like, just it was very common in African American women after childbirth, and they was like, within 6 months, it should go away. So, this new diagnosis, I don't know what it is, but I'm on this new medication now. I had to change my diet, which I did for the most part. I did the low salt, no salt diet. And then, so at the end of December, I started having, the chest pains again and the shortness of breath. So I met with the cardiologist. They looked at my heart function and realized that my ejection fraction was 10 or 15%. So from there, the plan was we're going to put an ICD in me, just in case your heart fails or stops, and this is shock it back in place. And we're going to change the medication, go up on some medication, blah blah blah. And the doctor, I had questions, but I don't know if it's just they just really couldn't answer the questions about postpartum cardiomyopathy or peripartum cardiomyopathy. It was just kind of like I don't know, one of those subjects where it's just not talked about. And, they didn't have the answers for me. So I actually had to do some research myself on Google. And that's how, I found you from like the little hashtags on Facebook and everything. Um, so after I got the ICD implanted, I went back to the hospital because I was still having like, trouble breathing and my heart wasn't responding to the medication. So I went to a different hospital. I was being treated under the ICU team. they were great. But it was only so much they could do. They put me on like the IV medication, Milrinone. So I was like carrying around this spinny pad for like 3 or 4 months. And after a while, my heart just wasn't responding. And they were like, we're going to refer you to Emory for the heart transplant evaluation. And it was just a lot. Like, because I'm like, okay, from the first time I went to the hospital, I felt like they dropped the ball because they didn't diagnose me correctly. And I'm telling them my symptoms, and it's like you're just being brushed off. You're not being heard. And then when you finally get a diagnosis, they don't have like any information or any answers that you need. And it's like, they keep saying, oh, you're going to recover, you're going to bounce back. And here it is. I'm the opposite. I'm in heart failure now. And now you're talking about a heart transplant. And my husband and I, we don't have family in Georgia, so like all our family's in Texas and Mississippi. So, family's worried, and they're been so amazing. Whenever we need them, they come. So we're very thankful for that. But my husband's still recovering from his motorcycle accident. I have this newborn, I have his daughter as well in school. So it's just a lot at the time, and I was just like, I need to breathe, but I can't breathe. So I went through this evaluation process through Emory, and it was so long and it was overwhelming. And there was times when I even started questioning, like, do I really want to go through this? I mean, like, for one, it's expensive. Um, and I just had so much going on. I'm like, I can't do this. And then in the middle of my treatment, my insurance at the time, my health insurance, Blue Cross Blue Shield, they like decided to not be a part of a network that I was getting treatment at, and so I could be on the transplant list. So now it's like, okay, now I have to pay out of pocket or try to, hurry up and get listed so I can be in network. So every visit I had to go to, because I still had to get medication. It wasn't being covered. I had to like do the out of network. And then, you know, we always kind of been independent. So asking for help was hard, but we needed it because you have to have a down payment to be once you're qualified for the list. And then they want to see that you have the funds, that you have the insurance, that not only do you have this, but are you mentally ready for this thing? And when I met with the team, they were like, oh, you're young, you're healthy, you're going to bounce back. And this is what I'm thinking of. So um, I got listed as a status 4. And I was doing okay at home. I had all this medication. I was just tired. Like I had no energy. But I wanted to stay home because you either stay home or wait in the hospital. And I didn't want to be away from my family. It was just gonna be too much. But I stayed home as long as I could until I couldn't. The Milrinone stopped working. So now my heart is like barely breathing. And it was time. Like I tried to fight it as long as I could, but as soon as I went to Emory, they admitted me, and I stayed in the hospital until my transplant. Actually, a few weeks after the transplant, I had rejection. So waiting in the hospital was hard because I was in the ICU department. I was away from my kids, and there's a lot of sick people there, so I didn't want my kids there. Um, in order to move me up on the list, inserted an impeller in me. So it was basically having my heart beat for me. Um, and I remember the first time I got an offer, I was so excited because I've been waiting for 2 months in the hospital. I'm like, I'm ready. My stepdad drove 12 hours nonstop from Texas. My mom was already down here. So yeah, I got that offer. I was getting prepped and everything. And then, everyone's praying and we're excited. And then next thing you know, before they take me back, they come in and they're like, I'm sorry, it was a DCD donor. So unfortunately, the heart wasn't valuable. Once they took the person off life support, there's a certain time and it's like they can use the organs before they shut down, and the heart is the first to go. So I was so fresh because here I am, like I'm ready to get this over with because for one, the hospital food was horrible. I'm missing my kids, and it was just, I had to rely on the nursing staff and the doctors to be my family at the time. And they were amazing. They took really good care of me. But I've seen some things in the hospital that scared me. Like, there was 2 people that was actually my neighbors, and they both coded and passed away. And I got to see that, see the team, the doctors rushing to them because they left my door open, which, I mean, I understand they're trying to rush to the code, but it scared me because it happened within a day apart of each other. And it was like my neighbors, like they were right next to me. And I was like, is this going to happen to me? But So I freaked out when that happened. And, I called my husband. I was like, you got to come get me. And he's like, no, you got to stay there. And I was just scared. So I called my father-in-law, who's a pastor, and, he gave me the word. And then the chaplain came in because they seen me. I was like terrified that I just seen two people die within a day apart. And I just had all these thoughts. So I was ready to go. So when this heart didn't come, I shut down completely. Like, I just, it was like I had no emotion. And the nursing, they tried their best, like keep me up in spirits, and it was just hard because I didn't know when another offer was going to come. It's not like you can say, okay, well, you're going to get an offer next week. Um, so I think that time it was just a dark place for me. So I'm like, how long am I going to wait? I was in this transplant journey on Facebook, and I seen people, they were in the hospital for 6 months to a year. They were on the list for so long. And I'm like, is this going to be me? Like, and again, my daughter was in school, so I was missing so much of her life, as well as my son, who's a newborn, and he's having all these like first moments that I'm missing. So that was tough. Like I said, I just kind of like shut down for a little bit, and I'm sorry, but a month later, I got my second offer, and I actually denied this part because my team told me it was like a high risk part. Um, when I thought of high risk, I'm like, okay, what is this? And they couldn't tell me exactly what they meant by high risk. It was just like it's like just different factors. It could be like, the person engaged in like, they could be like gay, or they had like drug use, or they were in jail, or anything like that. That's considered high risk heart. And I'm like, I don't want that heart in me. So I was like, I denied the heart, and my team came, and they explained to me that I told them like, what if they had like HIV or something that you can't get rid of? I don't want that, and they assured me that it wasn't that, but they couldn't tell me exactly what it was. But they told me this is a good heart, the 99% match. And, again, the outlook was really good. Everything was looking good. And, they want to get me healthy and home with my baby. So I prayed on it, and I was like, okay, let's do it. My family, they were excited, but I wasn't excited. I was still numb because the last time I got excited, I was let down. So I tried not to get my emotions at this point. So the surgery was scheduled. I woke up, and when I woke up from the medication, I had a tube in my mouth, and I was confused. I was in so much pain. And at the time, they call it ICU delirium, but I'm still struggling with that now to this day. That's impacted my mental health. But I just felt like the nurse, I was on a different floor this time. I felt like, the nurses weren't as caring as my other nurses were. And here I am even more vulnerable than I was before. And, they're just rushing, they don't have that compassion and empathy that I need to get through this. So I woke up in pain, and when they took the breathing tube out, I'm screaming like the medication. And at the time I felt like I didn't get the medication. And my husband heard me scream, and he was outside, so they wouldn't let him in. So he came running in, and he's like, what's wrong? And I couldn't talk, but I was trying to tell him, and I was just crying and screaming. And um, that was another dark part of my life because again, I felt like the nurses weren't there for me on this floor. I get it. The hospitals are understaffed, so they have, I won't say kids, but they have the young nurses that start at the high nursing school, and they're like kind of childish and inexperienced, and they just didn't have what I needed. And I thought it was just me, but I asked other patients that I still talked to as well, and they said the same thing about that floor. I'm not gonna say what floor it is, but anyways, so I voiced my concerns to my doctors, and I was telling them what I felt like was happening, and that's when they told me, you've been dealing with ICU delirium, you've been in the hospital so long, the medication that you're on, it's just, making you see things and hear things, and it just felt so real, like what I was going through. And at the time, I felt like nobody was listening to me. I wasn't being heard because I'm telling, my husband and my family, and of course they're listening to the doctors because the doctors have, they went through this. And everyone's like, you're okay. And they're just, again, brushing it off. Like, I'm not being heard again. And so, anyways, I stayed, I had a biopsy the next week, and I had a rejection. So I had steroids, and I had to stay a little longer, which delayed me from going down to the step down unit. And My second biopsy was another rejection. So again, they moved me to a different floor because I couldn't sleep on this floor. Like again, I kept hearing and seeing things that I still to this day feel like they're true. That um, yeah. So anyway, they moved me to the floor because they seen I was not sleeping and they felt like this was contributing to my health, like, not being able to sleep. I wasn't eating, I was just paranoid. So when I got moved to a different floor in a different room with different nurses and different care, I started to be able to sleep. And so my next biopsy, I had another rejection. So then I'm like, okay, three rejections back to back. Like, what is going on? Like, I thought it was a sign from God saying, you know, I told you before, to reject this part, but you took it and, whatever. So the team, we did more steroid treatments. And again, this is around Christmas. And I'm begging my team, like, let me be home for my babies because I already missed Thanksgiving with them. I didn't miss, Halloween and so much. So I begged them to, like, just let me go home and I'll come back. So thankfully, on all the steroids and increase in medication and, just getting up and walking, my next biopsy, I had a one. So they were satisfied and I got to go home for that. So I went home. I got to spend Christmas with my family and I didn't even want anything. I just wanted to be around my children. And we had so much support, from people from high school that I went to high school with, like donating and setting up things for my kids to receive toys. And my daughter's school selected her to like shop with the hero. So she was selected and she got my son some toys. She got to shop with a police officer. And, we just really had community help. Our neighbors, our church family, they did fundraising and I'm just so thankful for all of them. I had a high school person that, donated $25,000 to me to help. So I did have the support. So I can't say I was alone, but I'm going through this alone. Like nobody really knows what I'm going through. And so when I got home, I felt like, the medication is overwhelming. I take so many pills, even for the day, like each day at certain times. I'm always checking my weight, make sure I'm not retaining fluid. I have to check my blood pressure. It's a new lifestyle. And now, so when I'm going back for follow up, they're like, oh, you have type 1 diabetes. Like your sugar is like way too high. I was in the 600. And that was something I had to adjust to. So I've like never had diabetes before. And it took me 3 months to get it under control. Like I'm on the Dexcom. I take two insulins 3 times a day at a high dose. And I'm also taking a weekly shot Manjaro. So on top of all these pills I'm taking like 22 to 24 pills a day. Now I have to worry about insulin. So I told my endo doctor that I need help because like I don't know what to eat. I don't know how to do this. And he set me up with a nutritionist who's amazing. And she gave me like a meal plan and they just expressed the importance of like me actually making a lifestyle change. They're like, no, your sugar is too high where you can go in stroke range and you've already had these rejections with your heart. I'm like, okay, fine. So I really started taking it serious and I've lost weight and I've changed my eating habit. Like I don't eat sugar. So that was hard, but I had to do it because, I want to stay at the hospital. And especially what I went through after recovery, I'm like, I don't want to go back. Um, and then I developed shingles and that was so painful. So my heart goes out to anyone that's dealing with shingles because it itches, but it burns and it's just painful to touch. And they didn't even know what it was at the time. I was like telling them when I was in the hospital, I was like, my back is like really itching. And I showed my mom and my husband, they're like, well, you have scabs on there. And they were thinking it's like bed sores. And then they had like an infectious disease doctor come and like, he's like, well, it's not like blistered or bubbles. So I can't really get a sample, but he's like scraping it. And so anyways, it took them like 2 weeks to figure out what it was. And it finally came back that I had shingles. And so now I had to take like another medication. So I'm like, how did I get shingles? But my immune system was so compromised, like anything, went wrong, went wrong. So now I have shingles, I have diabetes, and I'm still like, high risk as they consider it for my rejections. So one of my next rejections, my next biopsy came back. I developed the CMV virus. 'Cause the antibodies from the donor and mine weren't mentioned. So now that's another medication. And each time I go to the doctor and get biopsies, depending on the results, they either increase medication or they're like decrease it a little bit. Um, so I'm struggling with this. And then I noticed like since they've increased some of my medication, I'm losing my hair. I had long, healthy hair, and I was, as a woman, you take pride in that, and now my hair is starting to fall out, and um, that was hard because I felt like I was just losing myself, and I couldn't control nothing that was happening to me. And it's like, okay, the doctor said you are a great candidate, but yet, there was like some of my friends that I met in hospital. They were older than me, and they had a heart transplant, and they weren't going through none of this. Like, they were thriving, and here I am, young and overall healthy, and I'm having all these setbacks. So I started, kind of questioning God, like, what am I doing wrong? Like, so when I started losing my hair, and like, every time I would just rub my hands, I would have balls of hair and it's so thin. I was like, okay, let me just go get it cut, see what they can do for it. So I had to get my hair cut, and my nails won't grow. They're so flimsy because of the steroids I'm on. And um, so going back up, my heart wasn't beating the way it should be. So they put a pacemaker in after I just got rid of like the ICD and the Impel, and now I have a pacemaker. And you're thinking like, okay, I have a new heart. Why is it not working? Like, so I still have a pacemaker. It's being managed, every day. I have my app. I have the Dexcom in my arm for my diabetes. So I have the app for that. So my team, they're great. They always have a plan, but it's just, it's like they can't really tell me exactly what I'm going through, but I'm going through. And I understand that, nobody really can. And it's just part of my testimony and the journey that God has on me. But it's like, how much more can I say? And then my last two biopsies that I had recently have been rejection, which caused me to be retransplanted or relisted back on the transplant list. Because they can't keep giving me the high dose of steroids because it will start affecting my liver and kidneys as well. So I am relisted as a status 4. However, I'm not having all those symptoms I was before. And my blood pressures have been good. And I have like headaches every now and then, but I'm staying active. And um, I think the most important thing is I haven't been able to really talk to anyone who understands or who's listening to me. So I did reach out to my transplant team, and I'm seeing a therapist, and I am talking with a psychiatrist. They did put me on some medication to help with my mood, and um, that has been really helpful. Just from everything I've experienced, like I just haven't had a chance to breathe. It's always just something that's been happening, and so that's what I'm dealing with. And then, just following everyone else's stories on the PPCM chat, like so many women are going through this, and it's like it's not being talked about. Like I've never heard of peripartum cardiomyopathy until I was diagnosed. And then when I was diagnosed, I didn't get any answers that I needed or that I was looking for. Like nobody can tell me why it's happening, how it happens, how to prevent it. Like, it's like a lost language. And especially as a Black woman or mixed woman, whatever, I feel like Black women, we are so neglected in the world, and then especially in our health. And I wish back then, like when I first went to hospital, I would have spoke up for myself, but I was so scared, like, because like they're doctors, I didn't want to question them, and I didn't want them to think I was being difficult. But now you have to advocate for yourself. If you feel like something isn't right, you have to stand up for yourself because nobody's going to fight for you. And I feel like maybe if I was diagnosed properly and they actually took it seriously, I'm not saying they didn't, but they were more aggressive with it, maybe it would have prevented my heart from going through. Maybe, I wouldn't be having a heart transplant or be listed for a second one. It's just so many what ifs, if I don't have the answers for them, and it happened, but I'm embracing my journey, and I try to share on Facebook as much as I can. There are times when I just block out certain things. And, I just want to escape from the world just because of everything I'm dealing with. And I know people want to hear my story, and the responses I've been getting from them have been overwhelming, and the support and love, like from people I don't know and people I didn't think would care. It cares. And it really does help me. Keep pushing through and want to be here for my kids. Because there are times when I'm like, I want to give up. This is too much. Like, especially going through another heart transplant. Like, I am questioning it, but I'm praying that I don't have to get another one. But if I do, I'm praying for strength to go through the journey again because of what I experienced the first time. Just again missing that part of my children's lives that you don't get back. And every time I go in the hospital, I kind of like lose a part of myself. So I've lost myself so much already. So I'm trying to fight to get it, get back to who I was, even a better person. And yeah, so I mean, I have so many ideas of once I'm healthy, what I want to do, especially like, starting my big nonprofit for organ donations because so many people are just so uneducated about organ donations. And here I am, fighting for my life because I needed one. And there's just so many myths about it that I still hear people talk about. And I'm just like, you're ignorant. Like, that's not what they do. But yeah, I am very thankful to you for, starting this and putting yourself out there and sharing your story and your sister's story because you have reached so many people and you've actually gave me the courage to speak up because I didn't want to talk about this, but talking about it, it not only helps myself, but it helps other people that's going through it, or other people that care about you, or just want to know. Um, so it's good talk, and I'm thankful for our sisterhood, our heart sisters, and the heart transplant family I've created or found, and I'm just thankful for everyone in my life. Um, so yeah, you're doing an amazing job, and I hope sharing my story can help other women come forward, or just kind of recognize the same things and fight for yourself. Because again, no one's gonna fight for you. Um, you know, but we need to. The world needs to change. America, we're supposed to have the best healthcare in this world, and it's like we don't. And as a woman, you're already, kind of underneath the radar versus, with men and stuff. And then as a black woman, you're even lower. So it's just a lot, and things need to change. Like we should be heard, we should be taken care of. There's no way, someone else next to me just because they're a different color should be having better treatment than me. Um, but
Absolutely. Oh, thank you
yeah.
so much, Hard Sister. This was a beautiful, beautiful
Thank
testimony.
you.
Your journey is hard. It's hard. It's hard even listening to it. It's just and a lot of people won't know how to. It's like I've heard over time that people not gonna know exactly what you're going through if they haven't went through it themselves. And that's a very hard part because when you're the one that's stuck that has to deal with it it's hard, It's
Yeah.
just like I've been holding back my tears trying to make sure because even it's a sensitive topic for me as well,
Yeah.
And a lot my heart sisters know my personal story. A lot of people still learning my personal story or still learning what we're doing, trying to be able to educate doctors mainly, because that's another big part. Even in your story, you said that you feel like doctors aren't knowing what we need them to know. And
Mhm.
how are we supposed to change that as a patient, right? Like,
Right.
so God done blessed us with the media, and then if you see us on the media, oh, she's fine. She's on here telling her story. First off, I'm not fine. God has me on this assignment because it was either he gonna take me or you gonna leave me here to do whatever he wants me to do. And if I'm
Right.
staying here to do what you want me to do, I don't know what's going to happen to me. And then I have kids, we have kids. So I have to make sure that I'm able to be able to help God along the way on whatever it is that He has our assignments here for. And so that was a big part, or a big piece that I do take out of our journeys is that I feel like our voices should be used in a certain way. Um, because we just never know how God is going to use it, right? Like,
Yeah.
and so you are so brave,
Thank
and
you.
God is just going to use
Mm.
that to be, and not even just for others, for
Yeah.
yourself like you said, it's helpful for it's healing. When we talk about it, it's kind of something we don't want to talk about. A lot of black women don't want to talk about this. My sister, like a lot of people didn't even know that she was going through what she was going through because she was such a silent person. Like you didn't know what she was going through, So it took her having to be put in a hospital for us to see visually, oh my God, there's something wrong. So sometimes it takes people to see things for them to be able to kind of get a reality of it, but I'm like, we're not lying,
Yeah.
like got papers to prove we shouldn't have to do all
Right.
that.
Right. Like, why would I do this for attention? Like, who goes this far? But I totally understand because there's some things that I still don't tell my family because I don't want them to worry. But it's like I have to put on this mask, and on the inside, I'm just dying and crying for help. But
I'm
on the
tired of
outside,
wearing the mask.
yes, and it really breaks you down. I think I was getting to a point where I couldn't take it anymore. And I didn't want to be in this dark, dark place. So I was like, I have babies that I need to live for. So something
Mm-hmm.
has to change. And trusting God is so hard. I mean, like, you can sit here and say, oh, I can tell you trust God, trust God. But if
Mm-hmm. Mm-hmm.
you just really have to trust him, you have to not question him and say, God, whatever you're doing, just don't do it without me. I trust you. And I think that's just so, that's the, one of my biggest things. Because like I said, everything that's happening has made me in the back of my head, like, why is that happening to me? Like, why me? What am I doing wrong? But he just, everyone has their own journey and purpose, and I'm glad that he's given me this, taking me through whatever he's taking me through, and whoever I need to reach or help or whatever I have to do, I'm gonna do it.
Absolutely. And so going back to where you said, I know it's affecting you mentally, emotionally, because PPCM sucks all the way around. Um, what do you feel, or how do you feel would help like that transition when you was going through okay, you went through a moment of having good nurses, and then you had to all of a sudden go through this again, all in trust of God, and then you get a team that isn't so helpful, what do you feel like or think could have transpired to maybe that we could probably push for, in the future, as far as like having more empathetic as team members when they are overwhelmed themselves? Like, how do you feel?
Well, for one, the unit I was in was very sick. It was like the ECMO, and you're just coming from a heart transplant. So I feel that for one, they should have experienced nurses, like, more mature nurses there, like not people that's, 1 or 2 years in nursing school. You really need those nurses that, and I know it's hard because nowadays it's like everyone just wants to work their chest, but there are good nurses out there. So their training needs to be better, for one. And then two, I feel like after mothers have their babies, they should still receive more postpartum care. Like, you should just have that 1 6 week visit and then, okay, you're done. They should be following up. I feel like it should be like every 6 weeks, saying, checking on you mentally, making sure that your insurance is still good, or, whatever they can, they should be doing. Because the women's bodies go through so much, and not only their bodies, like all these emotions that they're having. So definitely just like training better, the aftercare for mothers. And then, I mean, like I said, it's kind of hard for people to be empathetic, but I feel like, as an employer, that is your job to like find those nurses that truly are going to benefit, because they're there for the patient, and they're, representing the hospital, representing you. And I mean, I get, everyone needs a chance, but, if you're straight out of nursing school 1 or 2 years, maybe you can start, on another course. But it was just, I felt like maybe if they would have listened to me more and taken me seriously, maybe things could have, been prevented at the time, or maybe adjusted. But it's hard to say what needs to change. There's just so much in our healthcare system that really needs to change. And then we as people need to change, like we're so quick to judge, or, just think we're better than everyone. So it's just, people don't care about anybody else anymore. It's just all about themselves. You
Mhm.
know, it's just
And you
more
did
God.
mention, yes, you did mention that they had like a person who did have a transplant who kind of just elaborate, I guess, their story maybe. And
So
you said that
there's some,
it was a different transition for them as far as like what they're dealing. And then they probably was, I think, what, older and didn't have
mhm.
a new baby, right? Like,
Yeah, they were older. It was not women. It was two older guys that I really grew close with, because we were waiting around the same time, and we were, next door neighbors. So we really grew a friendship, special bond. And again, they were in their like 50s and 60s, and they would come. We would see each other, or they would come check in on me because I was dealing with, the rejection. They're up walking and thriving. I'm so happy for them that they didn't have such a tough recovery. Because they have their own story too, but I would talk to them like, hey, how is your treatment on such and such for? They cooperated with me. They said that the nurses were kind of like immature, and like at nighttime they would just be loud, and I mean, I get it, you're bored, but your patients are sick and they're trying to sleep. So why are you so loud and my door is closed? Like, I should be hearing you laugh. You know, um, there's sometimes when you would press the call button and they wouldn't come right away, and all of that. But so yeah, I just wanted to make sure I wasn't making it up, or I wasn't being this difficult patient, because I wasn't. Like I said, on my other floor, I loved my nurses, my team. I even made them like little treat bags, like they were my family. Um, and I still talk to several of the nurses still to this day. So I'm always grateful, and I'm even grateful for the other team. So, they were able to do it bare minimum, but I'm here, so they did something right. But they didn't. They definitely were trained. But yeah, I mean, the other two people, they did cooperate with me.
Okay. And with so what we're doing with Let's Stop PPCM, we're trying to be able to have PPCM patient advocates, where we actually train survivors on how to actually be an advocate in that field. Do you feel like if it would have been maybe a heart transplant recipient heart sister that would have been a good help probably through that journey? Or maybe if they would have had like resources over someone who could actually relate to actually having a new baby while trying to go through this.
Yeah, definitely. I really feel like, for one, having, whether it's a mentor or just the person there, to say, hey, this is what I went through, this is what's going to happen. Because, I mean, you can never, the doctors, they did their best to explain, what's next, but they left out some things. Like, the pain after surgery is excruciating. It's like worse than child labor. Um, they didn't tell you that. They didn't tell you the recovery is going to be hard. They didn't tell you that, as soon as you wake up, they're going to sit you up and try to get you in the chair. Like, they didn't prepare you for that. And as a mother who had children, there was no mothers there that I could talk to that, were going through what I went through. So it was hard. And I feel like maybe if I would have been able to speak to someone who went through what I went through, and, who can relate to me, maybe I wouldn't have been going down this dark place. I'm like, okay, I see this mother did it. They're strong. They're still doing it. They survived. But me, I'm trying to talk to my husband, my mother, my pastor, family members. They don't know what I'm going through. Like, they can say, oh, I can only imagine. I'm sorry, but you don't know what I'm going through. And then again, there's people that are like, oh, you look great. You're not going through anything. And I'm like, you don't know. Um, so I do think that every hospital should have, that mentorship or that advocacy for PPCM. And especially since it's so common now. Like I said, I've never heard of it until I was diagnosed. And now I'm starting to see so many women come forward and say, hey, I have this. And, now we're starting to talk about it. So I feel like every hospital should have a mentor or have someone that's educated on it, that would come and talk to you and tell you what to expect, and how things work, and, just let you know that you're not alone. They're here for you.
Oh, absolutely. Oh my God, I couldn't agree more. I feel the same way. And see, the part that gets me is that we're in the hospital, you get hit with this life-threatening condition. We still have to go home and be mom and be a spouse. And we don't like to, like you said, we're not, it's like God chooses the ones who don't want to ask for help. I don't want to ask, you don't want to have to be put in a position where you have to ask for help, even though I know there's a verse in the Bible where it states that, sometimes you have to be, the giver has to be the receiver, and, it's a blessing within it in itself. So again, it goes back to just trusting God, and in hopes that He will be able to create a team, or a circle for us to be able to adapt to that transition, because only God knows what we're going through, right? Like only He knows exactly how it feels, how you're feeling. And so I think that's another thing that brought a peace over the situation. Because even with like dealing with my sister, with the things that she had to be hearing, and that we had to try to, I'm like trying to keep her positive, trying to not, she was sad. She was going, nobody knew what she was going through. Even myself don't know what she was going through. Like, even though we end up getting the same diagnosis, but it totally affected her a totally different way. So like even when a mom do get hit with this condition, the story is different. Like every time we hear a mom story, we don't know what was happening in that mom's life prior to the pregnancy, during the pregnancy, leading up to the condition, the symptoms, And then, like you said, what you have to go through after the fact is what we're not hearing. I need to hear how many medications that I may be taking. I need to hear, like, I don't want to hear, oh, I'm young and I could just get through it. Okay, I'm young, yeah, thank God. But who wants to be young going through the rest of their life with like a deadly condition? Like that is not, like, no, I'm gonna talk about it. Y'all gonna hear me and we gonna be so that's why I was like, no, let's talk PPCM, because that is what people need to be knowing about. That's what new moms need to know about. We ain't trying to scare no new mothers. We didn't know we was gonna get it ourselves. We didn't want nobody telling us that something bad was gonna happen to us during pregnancy either. We don't want to hear that stuff. But you got preeclampsia that you checking us for. You got eclampsia you checking us for. You have this glucose, all that stuff that they checking us for. Diabetes, gestational diabetes, you checking us for. Okay, well, you need to check my heart and make sure my heart is okay and that it's pumping well enough to where I could sustain this pregnancy. And then sometimes we found out that sometimes mom's heart actually be weakened before the next pregnancy. And so if you're not knowing that your heart is weakened during that pregnancy that you just successfully went through, your heart could be probably at 45%, ejection fraction. And you would never know because that don't come with symptoms, that quick, so you might have a little shortness of breath, but then the doctor's gonna say, oh, that's normal. That's happens during the pregnancy. So that's what you're holding on to. Everything is normal. This is fine. And then to months later or weeks later, oh, now you need a new heart. You need this implantable defibrillator, all this big what? Like, what? I was fine and that was normal. Like, so yes, it's a big transition in our lives. And I feel like that's not something we have to hold in. Like some moms don't get me wrong. Some moms aren't able to share stories like how others are blessed to be able to share the stories because it's hurtful. It's a hurtful transition, and we have to live through it. And so that's what one thing. So if God is going to bless the ones that are able to help to bring light to this condition, that's what we want to do. And I just want to thank you so much, Heart Sister, for being able to be brave and be able to be here to just share your journey, because that is a hard journey and we are with you. Your Heart Sisters are here for you. We love you. We want to make sure that we can try to just pray your way into happiness some kind of way and out of this. I just wish we could just take all the pain away and the stress away. And I know that we can, but I know that God has a plan for you and you're gonna make it through this, and your babies, you're gonna watch them grow, and it's just gonna be a beautiful transition. And I'm so excited for you.
Yeah, thank you. And I appreciate you for everything you're doing and my heart sisters. Thank you all for the love and support and prayers. And, I hope even if it touches one person, I'm doing my job. So, y'all be strong. Speak up for yourself and just stay prayed up.
Amen. Amen.